a pleasure to recognize the gentleman from New York, Mr. Engel, for 5 minutes.
Thank you, Madam Chairwoman, for holding today's hearing on the drug epidemic plaguing our communities. In my home state of New York, opioids alone claimed 3,000 lives in 2017. Last Congress, this subcommittee led the efforts to draft a legislative response to this ongoing public crisis, which culminated in the enactment of the Support for Patients and Communities Act. This package, including my Bipartisan Results Act, which directs the National Mental Health and Substance Use Policy Laboratory to issue new guidance to applicants seeking federal funding to treat or prevent mental health and substance use disorders. The Support for Patients and Communities Act was an important step forward, but it lacked the federal funding necessary to expand access to treatment. To that end, I'm a co-sponsor of the Comprehensive Addiction Resources Emergency Act, which would provide $100 billion to combat the drug epidemic. This epidemic also disproportionately affects communities of color, which face additional barriers and challenges in accessing treatment. I'm working on legislation which would direct the Department of Health and Human Services to commission a study that would look at ways to expand access to substance use disorder treatments in minority and underserved communities. I look forward to hearing from our witnesses on the federal government's ongoing response to this crisis and ways that we could strengthen it. My home state of New York is one of the leading states for training physicians. The training hospitals in my state constantly tell me that we need additional residency training slots in the field of addiction medicine to promote access to substance use disorder treatments. The Opioid Workforce Act, which I've co-sponsored and is under consideration today, would increase the number of federally supported residency slots in addiction medicine, addiction psychiatry, and pain medicine by 1,000 over 5 years. Admiral Giroir, I hope I'm not ruining your name too much. If I am, I apologize.
It's all good. I respond to anything. It's great, sir.
I know before you spoke about Cajun accents, so I figured, oh, when it gets to be my turn, am I going to blow it? Do you agree, sir, that we need additional providers in these specialties?
Absolutely.
Thank you. The ongoing drug epidemic has had a tremendous impact on children, whether it's witnessing their parents overdose on opioids or being torn away from their families and put into foster care. Admiral, let me ask you again, and let me also ask Ms. Brand, what efforts have your respective agencies are your respective agencies taking to ensure that children who have experienced trauma as a result of this crisis are getting access to the services and supports they need?
So, sir, Admiral Joy has deferred to me to answer at least a couple of these. One of the things that we have done is, I mentioned in my opening testimony about our maternal opioid misuse model, where we are looking to allow for more coordinated care and support for mothers, particularly postpartum, when their children have neonatal abstinence and when they themselves have addiction problems. We also, in accompanying with that, gave grants to a number of states for what we call Integrated Care for Kids, or INC model, where it actually allows for things like occupational, behavioral, and physical health services to be covered, so the full suite of wraparound services to really be able to treat children with those addiction issues.
I wanted her to highlight that because I'm very, very positive about those programs. We're also trying to, and I think it's an important point as a pediatrician, I would be remiss to say that a child with neonatal abstinence syndrome is not well once they become non-dependent. We now have good data that over the long term, they will have continuing issues, and it's really the responsibility of our society to nurture them through their childhood, make sure they get the interventions they need. So we have a very specific program trying to create the long-term data that we can have to support these children so they could overcome that neonatal experience that we know stays with them for many years.
Well, thank you both for the good work you're doing, and thank you, Madam Chair, Since you've been chair of this subcommittee, we've done so many important and wonderful things, and of course, this ranks with them as well, so thank you.
I thank the comments of the gentleman. We're all here to give and do for our country, and this subcommittee is front and center with some of the really challenging public health issues, so we have to keep the pedal to the metal. And now, let's see.